Well, thank you very much for that very kind introduction. I don't know about being a pop star. I wish I had pop star money. But no, during the pandemic, it really has been a moment of really trying to get out to the community and share very credible information that people can walk home and make a really informed decision about. Again, I'm Dr. Sneed. I am the founding dean for the Taneja College of Pharmacy, USFL. On behalf of our new president, President Rhea Law, and I'm sure many of you know her, we are really excited about her attaining that. And also on behalf of my senior vice president, Dr. Lockwood, Charlie Lockwood. I know that when you hear a pharmacy dean, you're probably thinking, I'm going to come up here for a 10-minute period and talk about medications. And during the Q&A, I'll try and answer almost any question you have about that. But around the country, I've become known as what is called the futurist dean. I kind of pal around with a group of people all over the country that really get into what's going to be the new and emerging technologies that can really bring healthcare to not only communities that can afford it, but bring it to everybody. I'll take you back to a quote. I'm going to paraphrase the quote because there's so many iterations of it. But a quote from C. Everett Koop. You all may recall he used to be the Surgeon General for the United States. And he made a very famous comment that every pharmacist will hold on to with dear life. You know, medications don't work in people who don't take them. Medications don't work in people who don't take them. And so over time, and many of you are in business, when we talk about disruption, and disruption in business, disruption in healthcare, disruption in transportation and education, we know that when we use that term, typically somebody is rising up and they're taking over, and somebody that used to do something is not doing it anymore. I'm always, anybody remember Danny DeVito and the movie Other People's Money? You know, in that movie, and I was really young when that movie came out, he made a phrase that stuck with me ever since. He said, you know, at one point in time, there were companies that made buggy whips. And he said the last company to make a buggy whip probably made the best buggy whip there ever was. But then the car came along. And now there was no need for the buggy whip. In healthcare, in many ways, we're going through a very similar transition, and we are certainly feeling it in the profession of pharmacy. You know, right now, you know, you don't have to go to your community pharmacy to get your medication. For many of us, we only have to walk about 10 yards to a mailbox and it's being delivered to you. But the actual fact of the matter is now that's where people like me come in to reimagine what healthcare can be. And so I'm going to put a few things out there very quickly for you to think about. Number one, it's really important to understand that the job of the pharmacist, to be perfectly honest, never really was to put the pill in the bottle. That's not really the job of the pharmacist. The job of the pharmacist is to know what the pill in the bottle is going to do for you as a patient. And we really are focused on trying to figure out what's going to happen when the medication gets into your body, what is it going to affect, hopefully in a positive way, and then reasonably have an understanding of how it's going to get out of your body. And that takes an enormous amount of chemistry, biochemistry, and now genetics. And that's where we are, and that's where we are as a profession. That's what we're re-emerging into. So again, the job is not to put the pill in the bottle. But over time, we became the purveyors of actual tablets and capsules, pills, potions, and elixirs for you all Harry Potter fans. But now we're re-emerging because we understand that, you know, there was a time we had 250 million people in the country, where now we have 330 million people. And people are getting to a point where they need more medication. They're trying to live a fruitful life. So it's really important to understand that now what I'm working on is how do we optimize that medication for you as a patient? How do we optimize it for millions of people and then distill that down to even one person, as I often say, that is probably within 5 miles of where we are and is waiting to have a stroke or a heart attack or is suffering with cancer or other ailments? How do we take what happens with millions of people and get to the point where we can monitor any and all of them at the very same time. And the only way that we achieve that is through emerging technology. Now, so that brings me to point number 2. What the things I'm working on, and I'll be very happy to, if you have an interest, if you're in this area, to partner with you. We want to measure and monitor the effectiveness of medication. I ask patients all the time. I ask my pharmacists and the students, when people came to pick up that bottle, if you're diabetic and you pick up that bottle of medication and you walk away, I say, did it work for that patient? Did their diabetes get better? Did their blood sugar come down? And the pharmacist behind the counter says, I don't know. And then you go, now, by the way, time out very quickly. I'm going to recoup 30 seconds here. Even as a dean of a college of pharmacy, my clinical practice now for over 20 years has been as a member of our Department of Family Medicine over at USF Health. And no, I'm not giving out medication. I get referred patients that have diabetes and high blood pressure, coagulation disorders. And I help 10 physicians manage the medications for those patients. We identify the drug interactions before they occur. We manage things when they're not working right, and we work really hard together as a team to make sure that we can optimize the medication for that patient. And I could give you an hour's worth of stories about how we've had really great outcomes over that 20-year period. So time out. So getting back to the measuring and the monitoring of the medication, well, how can we achieve that and not trample upon the autonomy or the privacy of an individual patient? And so now, I'm a health equity chair for the American Heart Association, and years ago I kind of commissioned a study. I just wanted to know how many people in America have mobile phones. And we found that, you know what? About at the time, 85% of U.S. adults had some type of mobile phone, even if you fell into a certain socioeconomic status. And so now, when we take this phone, everybody can do almost everything. I talk about the fact that I used to have a travel agent in New Orleans. She was a lovely lady named Julie from England. But now I sit on my couch and I do the same thing Julie used to do. I book a flight, I get the rental car, I get the hotel, I pay for it, and I do it right there in the security of my house. This device here, we need to turn it into a healthcare device, a little bit more than what has happened. So again, I'm working with multiple companies right now in terms of working with patients so that we can help to identify people whose medications are not working the way we intended. Because when we don't get medication working as we intended, over a period of time, if you have high blood pressure, even if it's not that high, we know it's going to lead to heart failure. If you have uncontrolled diabetes, we know the vast amount of complications that can result from that. And GI problems and a whole host of medications. And so, again, this conversation really talks about how can we take emerging technology and apply it in a way that we can help optimize the health of the number one intervention that patients have. Number one intervention is not surgery. It's not going to your physician. The number one intervention, medical intervention in this country and probably around the world are our medications. And so when you have that much medication being given for good, we have to offset that by making sure it doesn't do bad. And that's our goal. And that's what we're trying to accomplish in our Taneja College of Pharmacy, is to try and unlock the imagination and creativity of our students. We're trying to help them think differently as they emerge from the program. We're going to teach them everything that everybody else has ever known. But how can we try to inculcate into them that when you do get out into the market, that look for the opportunity to apply these emerging technologies for patients so that we can improve a communication pattern and then get back to the data and analytics of healthcare, which really does mark moving into the second quarter of the 21st century. Think about that for a moment, and then I'll be happy to take any questions. We are now just a few years away from being in the second quarter of the 21st century. And I'm looking around, and none of you in here are young enough to not remember when Y2K was going to shut down the entire planet. Okay? Now, oddly enough, I do talk to people that have no idea it even happened. I'm not recruiting them to come to our college. They're so young. I said, what? I don't know this Y2K. What are you talking about? So, as a country, I feel that we need to do better. We need to lead in terms of healthcare evolution. And right now, right here in this Tampa Bay area, we are developing an ecosystem, okay, with business. We're working with the Tampa Bay Economic Development Council. We're working with the Tampa Bay Partnership. We're working with an enormous amount of companies. About a month ago, you may recall, we had one of the largest technology symposiums right over here for a 2-day period, maybe even 3, over at Amalie Arena. You put all of that together, all of a sudden, little small Tampa from 20 years ago has now emerged as one of the top 5 markets in terms of technology, in terms of people wanting to come here, in terms of the biotech companies wanting to be here. And we're going to capitalize on that opportunity, once again, by having an enhanced level of imagination, creativity, and opportunity for everyone to want to come here, to do business here. And we're going to train all of our pharmacy students, medical students, nursing, public health, physical therapy, our PA students. We're going to train everybody to be ready and prepared for that new and emerging 21st century healthcare system that many people know. We already have the technology, by the way. We're not talking about having to go out and create new technology. What we need now is adoption, not only from the patient community, but from the healthcare community. And we're working very hard to make that happen. And the very last thing I'll say, because this comes up all the time in other venues, well, all of this technology and phones, well, what if you fall into a certain social class that can't afford that? Well, that's where we work harder to work with companies like Florida Blue, Humana, Aetna, AdMed, United, CMS out of Washington. Because the more important thing is to get data from people, more so than the cost of the device to give it to them one time. I want a Bluetooth blood pressure cuff on every patient that has high blood pressure, regardless of where you live. So we're finding ways to make sure that we create a society where equity is at the core of what we do, because when we don't have that healthcare component in that group doing well, the next time we see them is going to be in the emergency room over here at Tampa General. And we don't want that. We want everyone to be healthy. The healthier the entire community, the healthier all of us can be. So I'll pause right there and take any questions or answers you all have, but thank you for allowing me to not talk specifically only about medications and drugs, and you all were expecting that, but to give you a vision of what can be in terms of the emergence of technology that can help me and my pharmacy colleagues treat patients better than they've ever been treated before in this country. Thank you very much.